on just a second, Dorothy. Okay. Hi. Dorothy Thomas, can you see and hear us?
I can't see you guys, but that's okay, I know you're there.
Okay, yes, we are. You've got a audience of about 60. Let me give you a quick introduction, and then you can share your story and we can ask some questions. So Dorothy and Thomas have been together for 10 years, and we're a couple who faced a long journey with infertility. They lost their first child, Olivia, in 2021, where they connected with their genetic counselor, Meg Homeyer, who guided them with compassion and care. Today, they are the parents of a 1.5-year-old daughter named Ella and are expecting another baby in January. So, Dorothy and Thomas, thank you so much for coming, and I will open the floor to you to share your story.
Thank you everyone for having us here today, to be a part of Genetic Counselor Appreciation. As you know, I'm Dorothy Thomas. I'm actually a nurse at Stanford Radiology and Thomas is a police officer. I have some notes written down because I didn't want to lose sight of the details, but essentially we had our first pregnancy in July of 2021. My pregnancy was pretty smooth. There was no issues or complications.
Sorry, hold on, Dorothy. We lost your audio for just a second. Okay, I think we're good. Go ahead.
Okay. I mentioned that we had our first pregnancy in July of 2021 after struggling with years of infertility. My pregnancy was, smooth sailing. There was no issues up until I had my 19-week anatomy scan, where it was discovered that our baby had cysts in her brain. At the time, I was told that it was benign, it was normal, it's common, and that it would go away. And so I was recommended to come back 2 weeks later. By that point, I was about 22 weeks, and I never expected to hear the news that something was wrong with our baby. Dr. Rubasova was our pediatric radiologist who discovered that our daughter had something called Apert syndrome. It's a very rare genetic disorder. It's actually a de novo mutation, which isn't passed from the parents. And so it affects the FGFR2 gene, which consequently affects the baby's skull, the baby's hands, baby's feet. It can lead to multiple surgeries in their early years. They may have breathing issues, eating issues, cardiac problems, vision problems, and hearing issues. Immediately my reaction was that I was in utter shock, because I didn't expect it. And so, Dr. Rubasova quickly told me that she was going to help connect us with a really well-respected genetic counselor who was Meg, and she escorted us quickly to the room. I've never heard of the term genetic counselor before, so it was my very first time. And when we went in there, Meg was very calm. She explained to us what Apert syndrome entails. I mentioned that I was 22 weeks,
and in the state of California, we would have to make a decision for our baby up until 24 weeks. And so we had to work super fast. Meg arranged for a stat MRI for us. She also arranged for an amniocentesis to help confirm the diagnosis. And all of this was just a whirlwind. I was trying to process information, I was trying to make arrangements at work, and we just needed to get all of this done and expedited. Let's see, I remember those 2 weeks were probably the hardest and most painful time that I ever endured. And I remember calling Meg almost every day, asking questions. I think I was going through the emotions of shock, anxiety, just scared. And anytime I asked Meg for any request, she immediately supported me. I really wanted to know the quality of life for our baby and how severe she had her disabilities, her deficits. Because as a nurse, I feel like I could care for her. I care for patients. As a living, I can definitely care for our own baby. But I just wanted to know like how severe it was in her quality of life. And so Meg set up like an ethics committee or like a meeting, a panel with multiple providers. I believe there was a neonatologist on there, possibly a surgeon. And for me, I asked my colleague, Dr. Max Wittermark, who is actually the chief of Stanford Radiology Neurology Department, to help support me in the meeting and just listen in. And during that meeting, what they explained was that our baby's brain was not circular and round. It was rather a lampshade shape. Also, looking at her eyes, they were just grossly protruding and grossly bulging, which is indicative of elevated intracranial pressure. And so, aside from that conversation, I had a personal conversation with Max, and he told me that just looking at the images, he was very concerned with Olivia's images, and that he wanted to be honest with me and tell me that there's no way to guarantee what her life would be like, but she strongly will have deficits. And so, hearing that, I think we were hanging on to hope that, like a miracle, that she would be okay. But after the meeting and talking to Max, it just confirmed that, it wasn't going to happen for us. So, for me personally, I just needed to know that I was doing everything I could. So I reached out to Meg again and asked if I could maybe get a second opinion. So she quickly made a referral to UCSF, and then we drove out there. We did another scan, and their radiologist team pretty much confirmed the same findings that Stanford confirmed. I also want to mention that the whole time Meg was checking in on me, she provided us this book that's called A Time to Decide and A Time to Heal. And initially I thought that there was no way I could deliver a baby that I wasn't going to bring home. But after reading this book and hearing about other families, I realized that delivering Olivia and meeting her and holding her is a once-in-a-lifetime opportunity for us. I'm sorry, I'm getting emotional. But yeah, it was important for me to meet her. and like hold her and then say goodbye to her. So we did make the decision to deliver her. And so then on December 18th, 2021, she was born sleeping.
Take your time.
Looking back, I am, so thankful that Meg gave us this book. Meg gave us these resources so that we could make the best informed decision, because I think delivering her still today is something that I look back on and I remember. And so it's been 4 years since Olivia's loss, and Meg has consistently been a supportive point person for us. After the loss, we went through IVF to do genetic testing. Meg helped coordinate the blood work. We actually preserved Olivia's umbilical cord and blood, so we were able to extract that and create testing for our embryos. And then my subsequent pregnancy was with our daughter Ella, and Meg helped set up the radiology ultrasound appointments. She helped arrange for an amniocentesis. And then with this current pregnancy, I also had an MRI that Meg helped out as well. Like to us, I feel like Meg has changed our life. She has given me a gift of being able to meet and hold my daughter, which is something I never thought I could do. I think her compassion, just always being supportive whenever we ask for anything, has really made such a big difference in our lives. And we continue to keep in contact with her. She's been such a great advocate, just for our medical team, but also for our emotional needs. And so, I just want to tell Meg that Olivia is our angel in heaven, but Meg is truly our angel on earth, and we couldn't have done this or be in this position if it wasn't for her. So I just want to share my gratitude to all the genetic counselors and what you do every day for your patients, because you do make such a big difference in your patients' lives. Thank you.
Wow. Thank you. I can't tell you. Can you still hear us?
Hi everyone, I'm Thomas, Dorothy's husband. I've been a police officer for almost 19 years, including 7 as a school resource officer. I've had to work with many families in my career, and had to work with families during the hardest times of their lives, when their loved ones have passed away in accidents and suicides, in medical issues, and in old age. In 2021, we found ourselves dealing with the loss of our first baby girl, Olivia. And in that time, Meg was our beacon of light during our darkest times. She helped us through her empathy and compassion, her knowledge of genetics, and just being there as a friend. My wife's calling is to help people as a nurse. My calling is to help people and youth in my community. I think Meg was born to be a genetic counselor and help families in their time of need. We can't express how grateful we are to have Meg by our side throughout all of these years, and we want to thank her for all that she has done for our family.
Dorothy and Thomas, can you still hear us? Can you still hear us, Dorothy and Thomas? Okay.
Yeah, I can hear you.
We might have a little bit of feedback, so bear with us. We're so incredibly appreciative that you're willing to share that story, and for the record, we think Meg is great too. You really were in outstanding hands, and your story moved everyone in the room and everyone online, but I think it's especially important for our trainees to hear it as they're embarking on a career in this space, when they know that there will be a lot of hard times and challenging moments, and to hear that despite all of that, that companioning with folks through these dark times can make a big difference is huge. So we really appreciate it. Anybody have questions they want to ask? I have one. Do either of you want to comment on how your experience has impacted the care you now provide to Dorothy in your case to patients at the hospital, and Thomas in your case to the families and individuals you work with?
Yeah, I really think that experience has really changed me as a person in general. I think I've had a loss of a friend. I've had a loss of my dad, but I never experienced a loss of a child. And so it was life-changing. I now kind of look at life with so much empathy, so much compassion, and I've been pretty open about my story to like family and friends, and even friends of friends. If I know anyone that has been, actually after what happened with Olivia, a lot of people started reaching out, saying, hey, they know somebody that's struggling or going through like a miscarriage or a loss, like, would you mind talking to them? And I just want to give back. I think, and I shared it with Meg, that when we were going through that, I didn't know anyone who had to make such a hard, challenging, difficult decision. And so, Meg said a lot of people sometimes suffer in silence. And so I wanted to use our experience to like help others. And so I've been actually connecting with other families who've had similar losses, and just kind of sharing how I was able to work through it, the grief, and get therapy. And so I think when someone's gone through such great hardship, and how do you want to take it and move forward? And I don't think there's anything better than helping others. And so it's definitely been an eye-opening experience, and I just want to contribute back.
Thomas, anything you want to add to that?
Yeah, for me, it hasn't changed me too much in the fact that I think the way, the knowledge that Meg has and how she helped us through our whole experience, it just shows how good she is as a counselor. She knows how to talk to people, to families, explain things. I mean, I have a chemistry, nutrition background. Dorothy has her nursing background, so we understood a lot about genetics and biology and things like that. But obviously, in the world of genetics, that's not our realm, but that's definitely Meg's. And just like in our profession, in our field, I think we all care about the people that we deal with, and so it makes our job easy because we just act the way we normally would.
It's clear that both of you and Dan see part of your purpose of paying it forward and taking the care that you've received and passing it on to others, including everybody in this room and online. So we really thank you all for coming. This was incredible to hear your stories. Please stay online, stay around if you'd like for the remainder of the afternoon, but another huge round of applause for our students. right, so now Hipanshi will move on to our